So whether it's in a back office functionality or a clinical functionality, when we're talking about AI, where do you see gaps or maybe the largest gaps in health systems, both their intake, their evaluation, and then the ongoing monitoring of AI?
Yeah, it's a good question. And I just realized I didn't really touch upon the hesitancy, but this is a good place to discuss it where those gaps are. So I would say that the hesitancy, which is associated with the gaps, is the full bore AI. Okay. From what I've seen, machine learning is pretty much now commonplace pattern recognition to predict certain diseases and then get those images done for early lung cancer screening or get your diabetic patients in if you're predicting that they're going to have bad disease states. But the reasoning and planning and taking what the AI is telling you to do is another component of it that is not yet rooted for practical clinical medicine. We still want the clinician to make the decisions, and I don't think that's going away anytime soon. I think the augmentation factor will grow. But what we're seeing in terms of the gaps is building these tools is getting more difficult, requires more technical skill. And my opinion is one of the hottest fields in the country is data science, because everybody from the fire department to the hospital to the bank to Amazon, everyone has some component and need of a data scientist to help make sense of this, to help hook their tech, combine it with large language models and other components of what we've seen to then make their product even better, whether it's for ambient technology to then generate the notes and then prompt the clinician. I heard you discussing colonoscopy wasn't done. Do you want to order a colonoscopy? So connecting these dots and monitoring that internally and understanding how it works, I think we're a bit a ways away. In fact, I had a physician that contacted me just the other day that they had just this basic dashboard and one structured field is now not pulling, and they found out it hasn't been pulling this data for 3 years. So my response was, you got to look on the back end, right? You got to find out where maybe a patch derailed how that is read now. There's something there on the back end that you got to go through and identify. So simple enough for dashboards that were created by the hospital. But what if you have a glitch in your system of ambient tech or other component of full bore AI? You're going to need some massive technical expertise for that. And they're pretty much getting doctor salaries. So
Yeah.
it's hard for hospitals to find these people and keep them on staff.